gently pull down the lower eyelid. Apologize, I know it's very bright. Just turning to the outer corner, working my way in towards the tear duct. And then I will come on the left side. Just looking for very distinct movements in the eyelid. Hi, Semide.
Hi, Dr. Friends.
Welcome to the clinic. It's very nice to meet you. Thank you for coming in today.
It's nice to meet you as well.
So I have you in for a general kind of wellness exam today. I'm going to be having a look over your essential functions, head, ears, eyes, nose, and throat. Maybe a brief look at the scalp. Since you are a first-time patient, I just want to make sure that everything is functioning appropriately. Was there anything specific that you had any concerns about today before we get started with your examination?
I think I just have some tension and achiness in my neck and shoulders,
Okay.
and then it kind of radiates up into my jaw sometimes as well.
Okay. Does that come with any other symptoms like headache or migraine?
It does sometimes lead to tension and headache up in here.
Okay, so kind of like at the temporal region there.
Yeah.
All right. I will kind of have a look. I'll palpate around. Is there any pressure that you find behind your eyes or any like blurry vision, double vision, anything like that?
No.
So I typically like to start with a visual inspection. I want to kind of just have a look at everything, specifically since you said you were feeling some areas of tension. I'll look for any edematous areas or areas of swelling, anything that looks asymmetrical, if we have any differences from one side or the other. Do you find that the tension or discomfort that you feel is more so on one side, or does it tend to be about the same?
I think right now I feel a little bit more on the right side.
Okay. All right. So we'll have a look at that. Don't see any areas of obvious swelling just to start with, but I'll have a look and then I'll come around the back and kind of look at the scapular region, have a look at your shoulders. All right. So would you say that you're feeling any levels of pain today? Is it more so just overall discomfort in the area?
Yeah, I think it's mostly discomfort.
Okay. And have you had any recent illnesses like cold, flu, any sort of viruses that maybe could be causing some inflammation?
No, but my toddler has a cold right now, so
it could be that maybe you have some underlying symptoms. Okay, all right. So like I said, I'm going to go ahead and get started with the visual inspection. So I have a pen light here and the light is fairly bright. For this portion of the exam, you don't have to look directly at the light.
Sure.
So you're welcome to either close your eyes or just look somewhere across the room. I'm just going to kind of have a look at the overall external well-being. I'm sorry, is it okay if I go ahead and make the touch you now? I don't want to start with you there. Okay. So I'm just going to start by having a look at forehead. I like to start with cranial structure, look around the temporal region. You said you were feeling some tension in the temporal mandibular joint here, down at the TMJ, so I will palpate just below the ears and around the jawline. Don't see any signs of external inflammation, nothing that appears obvious. Also palpate around the sinuses there. And then as I look down the thyroid, I don't notice any signs of distension. No obvious displacement or asymmetry there. Just gonna move your hair. Just gonna have a look at the clavicle here, looking at your collarbone. And then as I look at the alignment of the shoulders, I do see symmetry there, as well as the elbows midline with the abdomen, which is a good sign. So your overall posture is appropriate. Okay. All right, so yeah, that looks okay. So I'm going to go ahead and begin with a few palpations to start with. So I'm going to put on a pair of gloves. I'm just going to palpate around your face, and then once I see that there's no kind of external deficits, no cuts or abrasions or anything like that, I'll remove my gloves and we can proceed with your examination. Sure. So coming back in to perform some superficial palpation, I'm going to start here, kind of at the top of your scalp, filling along the crown. Please do let me know if there are any areas of particular tenderness or discomfort. At this point, I'm just feeling around for any abnormal nodules, any areas of inflammation, which I do maybe just feel a little bit here at the temple. Slightly more on the right side, which is in line with what you described. And as I come down, just going to expose the ear. Just going to palpate here behind the ear. You have a rather large bone that can feel slightly tender upon palpation. Just a little bit of inflammation again on that right side. I'm going to come down the chin underneath the chain of lymph nodes that run here, and they can be a good indication of any underlying signs of infection if I do feel any palpable nodules. So typically if you're feeling well and your body's not fighting off any infection, then they will not be palpable. So just feeling around. Nothing particularly notable there. Just gonna come down and feel around the thyroid. So you've got a butterfly shaped gland essentially in the throat. Just gonna feel for any signs of swelling. Following down, palpating the clavicular nodes. Some bilateral palpation. I just want to feel for any differences there. I feel just a little bit of tension at the shoulder for sure. Just feeling right at the socket. So while I'm at the front here, I'm just going to have a look at your arms as well. I like to visualize the upper extremity and look for any abnormalities of the skin. You actually have very smooth skin, very soft, well moisturized. I don't notice any patchiness, no areas of particular dryness. A couple small freckles, nothing that looks of particular concern. And then as I look at the hands, just visualizing overall skin texture. Nails are very clean, well groomed. And capillary refill is in line with normal. So good blood return there at the fingertips. No signs of callus. Maybe some slight pinkening, but nothing that I would say indicates any signs of pulmonary edema or abnormal redness there. So that's very good. So coming along on your left side, I'm going to do the same thing, just having a look at the overall skin. Brief palpation at the ulnar bone, feeling along the elbow. No signs of inflammation there. Again, just a couple of freckles. You do have just a little bit of mild scarring here, but it appears to have healed nicely. Skin is overall very smooth. And again, just checking for that overall return of blood flow, which is present in all 5 digits. Small scar on the index finger. Alright. As I have a look at the hips, I'm going to have you just lay your hands here for me. So just looking for symmetry at the pelvic bone, which is present in line with the knees as well. Do you ever have any issues with your joints, either upper or lower body? So like knees, ankles, hips, anything like that?
I do have rheumatoid arthritis.
Do you? Okay, so some stiffness.
It can flare up.
Okay. Does it tend to affect like your hands the most, or just kind of?
Yeah, I can even feel it right now.
A little bit of
my
rigidity
wrists
there.
and my finger joints, and my ankles and my toes are generally okay. It's mostly my ankles Yeah.
A little bit at the hands?
Yeah.
Okay. So I will have a look, check for some mobility, make sure that there's nothing, you know,
Sure.
super concerning happening there. So do you take any medication to help keep it under control?
I don't. I just use diet and lifestyle to
Okay.
kind of.
So as long as you feel like you're able to maintain and stay on top of it, okay. So I'm gonna do just a couple simple mobility tests here. You can let me know if any of that feels particularly rigid or if it feels okay. Just gonna rotate the wrist here. Just a little bit of tightness at the fingers, so maybe just some slight swelling, but nothing that feels, you know, overly concerning. You're not having any trouble opening or closing. If I can have you just make a fist for me, do you feel any kind of excess tightness there? Does that feel okay?
It does feel a little stiff.
little bit?
Yeah, I find mornings are stiffer than the rest of the
Okay, so that is pretty in line with rheumatoid arthritis. Sometimes your body needs just a little bit of time to adjust. So.
For sure.
So let me check it on the other side. Just gonna come in the other, out. So just feel about equal on both sides. And then if I can just have you make a fist for me again. So I feel that same kind of tightness on this
Yeah.
side. Alright, so I'm going to come around the table and kind of palpate around your neck, back of the scalp, and then shoulders. Okay. Alright, so coming around on the back side, I'm first going to just have a brief look at your hair as a whole. I just want to check for overall strength and integrity of your hair. Look for any signs of protein deficiency or any excess dryness or even gumminess at the shaft itself. So just doing a brief tugging. Hair is very long, nice and full. So I'm going to then palpate around the back side of the cranium. So just feeling along your scalp. Again, feeling for any abnormal nodules, any lumps or bumps, any signs of injury that you may have missed. It can be kind of hard to feel things at the scalp on yourself, so I like to do just a basic once over there. And as I come down the neck, feeling for swelling or inflammation here, which again is mildly notable, particularly on this right side. The left or right hand side.
I'm right-handed.
Sometimes I find that more dominant side can hold a little bit more pressure because you tend to, carry the load more on your side that is strongest. So that does make sense. I'm just palpate the musculature here. Do you feel the tenderness as I press down on some of these areas?
Yeah, just a little bit up there.
Yeah. So I'm also just going to palpate directly along the spinal column. So you're going to feel my hands here, just feeling for any signs of inflammation, any distension of the vertebrae. Overall, just feeling a little bit of that tension that you were talking about. And you said you have a toddler, and I'm guessing that you tend to carry him quite often.
Yes, very much.
I would recommend just kind of being mindful of your posture. Sometimes I find, particularly in new mothers, when you're holding your baby, you hold him in the way that's most comfortable for you and baby.
Yeah.
Not always in line with the best posture, especially for the shoulders and neck. So
For sure.
try to make sure that your core is engaged and that you're not kind of tilting forward so we can develop what's called an anterior pelvic tilt, where your pelvis is kind of leaning in and you're not engaging the glute or the core. So just something to be mindful of that can alleviate a lot of this pressure, especially as baby gets a little bit heavier. All right, Semide, I'm going to come back around the front and we can continue with your examination.
Sure.
All right, Semide, so we're going to continue with your examination. At this point, I'd like to do a couple tests with my pen light directly in your eye. So this can be just a little bit uncomfortable. It is fairly bright. To start with, I'm going to test for pupillary reactivity. So looking at your constriction and dilation, kind of independent and mutual response. So how your eyes work in connection to each other. So to start with, I'd like you to just pick any point on the wall across from me. So I don't want you to look directly in the light. And I am going to be coming just a little bit closer to your face now. So just start by coming here on the right side. So starting at the outer corner, working my way in towards the tear duct. And then I will come on the left side. So independent reactivity is about equal. And I'll do a faster test here and test your mutual response. Right. Now, if you have to actually focus your eyes on the light, and then as I come towards the outer corners of your visual field, I'd like you to let me know if you feel any increased pressure here. I come all the way out and then follow that very closely into the eye, which I know is just a little bit uncomfortable. You did very well there. Any increased pressure there?
Noticed a little bit, but I think it feels more like eye strain.
Okay, so I do see just some mild tearing building up there. So I'm going to palpate here along the sinuses. Don't feel any particular swelling there. Come over here just a bit more. So maybe some mild swelling there. So I'm going to have you do something maybe will sound a little odd. I want you to take a big breath in and then just kind of hold your breath. So we're going to increase pressure of the face.
Okay.
So just take a breath in and then kind of hold. And you can go ahead and release there. Okay, so maybe just some mild inflammation here at the sinus cavity. Alright. Okay. So I'm going to follow that up with our last lighted test. So after this, I will give your eyes a bit of a break. I'm going to come in with my ophthalmoscope, and this device just allows me to have a more magnified look inside your eye at your ocular anatomy. So I'll be coming in, I'm going to have a look at the optic disc and the anatomy that kind of allows you to see. Okay? So again, I'll have you just look at any point across the room here. I will be coming quite close to your face. Just come in with my light. And I'm going to follow that in. Pull down just very gently at the lower eyelid. And the optic disc does appear intact. I don't note any step-in or discoloration. Looks okay. Also, just going to have you look down for me. Okay. So the same thing on the other side. Same thing on this side. I'll have you just pick a point here. I'm going to come very close to your face. And following my light in here. And gently pull down the lower eyelid. Apologize, I know it's fairly bright. And I'm going to here. I'm just going to make sure that everything looks equal and symmetrical there in line with the other side. Alright, okay, give your eyes a bit of a break there. So coming in with a follow-up examination here, I'm going to increase pressure kind of externally towards the eye and test for a little bit of that reactivity. So you have some natural muscles in your eye that should make you blink as I kind of produce a bit of stimuli directly on the eye. So I'm gonna have you keep your eyes open just kind of lazily. I want you to allow yourself to blink as needed. I'll have you just look at any fixed point kind of here, the middle of the room. I'm gonna come towards your face with my iPad and just do some aerated sensation of the eye. I do realize this isn't the most comfortable thing, so just try to bear with me there. Very good reactivity, maybe slight overreactivity, just a little bit. So you appear to have more sensitive eyes. Just making sure that's equal on both sides and one side is not sensitive in the other. Apologies. This time I'm just going to perform a mild tapping. Same thing, I'll have you just look here. Just looking for very distinct movements in the eyelid. Nice and reactive. Feel just some mild distension here at the cheekbone. Have you hang your jaw loosely for me there, Semide? So just kind of open and then teeth separated for me. Good. Okay. All right. You feeling okay so far? So let's go ahead and move on. Just gonna gather a few tools here. I'd like to do a couple brief tests of your hearing. So because I'm seeing just a little bit of increased pressure, I want to make sure that there's no signs of like a sinus infection or an ear infection. So I'm going to start by producing a sound here and a tuning fork that's going to make a little bit of a higher pitch noise. So can you hear that okay? Okay, so that's what we'll be using for our first portion of the test. So I'm going to start. You can keep your eyes open. Can you tell me if you can hear that equally on both sides? Now I'll have you close your eyes. I'm going to produce the sound. I'd like you to just indicate which ear you hear it on. So, very good. Sorry about that. In here. Very good. I want you to tell me when the sound stops. So you should hear it now. Tell me when it stops. Stopped. Good. Do that again. You should hear it now. Tell me when it stops. Test for bone conduction. Do you feel vibration here?
Mm-hmm.
Now I want you to tell me if this is a 1 louder or 2.
2.
Good. Same thing on this side. You feel vibration here?
Yes.
Good. And if it's 1, is that louder or 2?
2.
Very good. Okay. On. Secondary hearing test, I'm just going to use these tweezers to produce a more delicate sound. And I'm going to test for directional hearing. So I'm going to have you close your eyes. You'll hear the sound start on one side, either left, right, top, or bottom. And I'd like you to tell me where you hear it end. So for example, if you hear it start here, that should end on the left side. Okay?
Right. I think it stopped like there.
Very good. Good job. Now lastly, I'm going to make this noise in your ear. I'm going to move it away from you. So further away in proximity. I want you to tell me when you no longer hear anything. Stopped. Very good. Very good difference there. So I'm going to do the same thing on the other side. You have excellent hearing, so you can go ahead and open your eyes. Didn't notice any deficiency with any of that. You did very well. Let's see. And have a look at your nose. Test for nasal patency, which essentially just is if there's any kind of occlusion of the nostril, if your nares are particularly closed off. So because we have a little bit of that pressure buildup here, I'm just going to have a look. So I'll have you tilt your head just very slightly back for me. And I'm going to come in and just have a brief look here. Maybe some mild production of mucus, but nothing that looks particularly concerning. Alright. I'm going to check just briefly at the back of the throat. If I could have you open and say, ah. Ah. Lift your tongue to the roof of your mouth. Come down towards the soft palate. And then just smile with your teeth. Very good. Very nice smile. Okay. All right. So far, everything looks okay. I think the last thing I want to do is perform an auscultation with my stethoscope. So I'm going to come in and have a listen to your heart and lungs. Listen for any abnormality there. I'll start at the front and then move my way around. Sure. So I want you to just take normal breaths, nothing super specific at this point. I'm just going to come in and have a listen. I'll start here, just parallel to that clavicle here. So listening right at the collarbone. We're not hearing anything particularly concerning. Heart rate is nice and strong. Just gonna listen for symmetry here. Okay, I'm just gonna have you sit up very tall for me, Semide. I'm gonna come down and listen just below the left breast, right at the rib cage here. Very good. So just listening over the abdomen, I do hear normal digestion. So I'm going to come around the back and have a listen to your lungs. So coming around the back, I'm just going to move your hair slightly out of the way. I'm going to have a listen here. I'm going to start just behind your shoulder. Just listening for respirations, normal inhalation and expiration. Listening for any signs of rapid breathing or shallowness. Any difference in symmetry on either side. Sometimes if there's a difference in auscultation from one lung to the other, it could indicate more of a pulmonary infection, but so far not hearing that. Also don't hear any crackling or wheezing. Maybe you take a deep breath in for me, Semide. And go ahead and release slowly. And again. Release. I'm going to perform a gentle tapping on your back just like this. As I tap you, I'd like you to say 99 out loud.
99. 99. 99. 99. 99. 99. 99.
Okay, all right. So that concludes this stethoscope assessment. I'm just going to come back around the front. All right, Semide, so I am going to go ahead and conclude your examination. I think at this point I would say that while I am seeing some signs of maybe a mild sinus infection, I do notice a bit of pressure buildup in the nose specifically, maybe just above the brows. I am just slightly concerned about the tension of the shoulders. I do think it's more so just related to posture and then carrying the load of a child walking around the day. So I would like you to be just a bit more mindful of the posture. Just try to keep upright at the shoulder if you can, engaged at the core, so it's not so much of a sucking in at the abdomen, but just making sure that those muscles are working. Okay, so that will help reduce a little bit of the load and the pressure here. If you ever have time or have the resources to do something more like a therapeutic massage, that can help alleviate a lot of that tension. Aside from that, I didn't find anything of particular concern. I think overall your exam went very well today. Did you have any questions for me?
I don't think so.
Well, I would like to see you again in about 6 to 12 months. I typically ask my patients to come in for a follow-up visit just on an annual basis unless you find anything, you know, in the meantime that happens and you're concerned about it. Otherwise, I hope you get home safely and I appreciate you for coming in today.
Thank you so much.
Thank you.